And then you also have your esophagus before your stomach. So it's not just peptic ulcers, but also another disease related to gastric acid. So remember, we have our stomach here, and there are two sphincters to the stomach. So you have your esophagus connecting to your stomach, and your duodenum from the stomach. So remember, we have our gastroesophageal or lower esophageal sphincter, and we also have our pyloric sphincter here as well. Well, what happened thing is that when your stomach is churning, what is it going to try to do? It's going to try to constrict these sphincters so that when you're mixing up and doing the gastric churning, that remember when you take any sort of closed vessel and squeeze it, what happens to the pressure inside there? The pressure goes up, right? So what if you're squeezing your stomach, but one of these sphincters opens up? Where is the contents going to go if you have all this increased pressure in your stomach? Well, if the gastroesophageal sphincter opens up or is partially open, that could cause that contents of your stomach to go the wrong way, and that's what we call reflux. So what's happening is that if, say, there's incomplete or or impaired closing of the lower esophageal sphincter, during gastric churning, the contents of your stomach can bubble up and reflux into your esophagus. So this is what we call, so a milder form of this is what we can feel like as heartburn. And why does it feel like, I was like, ooh, am I having a heart attack or is it just acid reflux? Well, again, remember that compared to your skin and your external surface of the body, we have that thing called referred pain, where your internal organs, they're not as precise at determining where things are occurring in your body. So that's why you kind of feel, I mean, your esophagus is running all the way from your stomach up to your mouth. So that's why if it kind of feels that kind of pain from this acid bubbling up into your esophagus, it kind of feels very general, but what else is in your kind of like thoracic area? Yeah, kind of this is why they nickname it heartburn. So again, not necessarily you're having a heart attack, but it's due to that kind of pain in your esophagus. But again, your internal organs have a hard time pinpointing exact. It doesn't feel like you have a tube that's hurting. It just feels like a general ache, right? So another reason is why, because many of the same nerves that innervate the heart also have branches that innervate the esophagus, so they share a common pathway. So this is why people are like, oh, I think I'm having a heart attack. But it's like, okay, do you have the numbness in your arm? Does it feel like you're someone sitting on your chest? Probably not, but again, sometimes it does feel to some people like they're having a heart attack because the same nerves are being tickled by this pain. So what can you take to alleviate the symptoms? Well, one thing, you don't have to immediately resort to omeprazole. You can take simple antacids. And how do they work? Well, they work by using chemistry. So things like Tums, they're pretty much mostly calcium carbonate. And calcium carbonate is the same as the mineral you find in seashells and eggshells. So pretty much Tums is ground up eggshells or seashells. Well, I don't know if that's exactly how they make that, but this is the same chemical, calcium carbonate. And yeah, and why do they taste that way? You're just adding sugar to calcium carbonate. Those are the primary two ingredients with Tums. Maybe you can make your own homemade Tums if with eggshells and table sugar, but that would probably taste really gross if you don't blend it well enough. But how does this work? So calcium carbonate, well, carbonate sounds like bicarbonate, right? So calcium carbonate reacts with protons very similarly. So carbonate ions, they just don't have that extra hydrogen atoms. So they're actually able to react with two protons and neutralize them to form relatively inert in terms of pH, like calcium ions, carbon dioxide, and water. So it's kind of using the bicarbonate, or I can't say bicarbonate buffer system, but it's very similar. Carbonate is reacting with acid and being neutralized into relatively inert carbon dioxide and water. Just like how in the bicarbonate buffer system, we have bicarbonate reacting with a proton to be neutralizing carbon dioxide and water. Or another way, like if you ever done this in elementary school, if you've had like, well, don't do this with like very special seashells that your grandma collected on the beach so many years ago. But you can take like a simple broken seashell or take eggshells, throw acids like vinegar on it, and what happens? Well, you see that they start bubbling up, right? So why do they start forming bubbles? Well, they start forming bubbles because of all the carbon dioxide you're producing, which is a gas. So that's why, yeah, you can do that at home. Just take white vinegar or any vinegar, eggshells or seashells, and throw them into the vinegar, and you'll see the bubbles form. That's carbon dioxide being produced. All right, so then, but if it's acid, this acid indigestion is happening not just after a really spicy meal, like maybe it could be a sign of that GERD we talked about, the gastroesophageal reflux disease. So now this acid is refluxing on a more consistent basis. So also sometimes it's simply called acid reflux. So what happens is the same mechanism. The gastric acid is going past the lower esophageal sphincter and causing pain in the esophagus. And there are multiple potential causes like pregnant women, and yeah, all of these can potentially cause GERD. And what can they do? They can, why is this kind of important? Well, it can also lead to further diseases such as ulcers. Like, again, just like how you're able to get ulcers in peptic ulcers in your stomach or duodenal ulcers in your duodenum, you can also get ulcers in your esophagus if you get enough of this GERD. Again, all of these really painful white looking things, these are ulcers that from gastric acid eating away at the esophagus. Esophageal strictures. So strictures is some sort of narrowing of a tube. So what happens is, like, I mean, every time you get these ulcers or damage, your esophagus is going to try to repair itself. But what if it's repairing itself so much at a rate that the tissues are starting to build up to the point it's starting to kind of like cause it to stiffen and narrow as it starts to build up thicker and thicker layer of tissues? So that's what esophageal strictures are like. And in Barrett's esophagus, this is a very fascinating one. Abnormal histology. What happens is that your esophagus has a normal way it looks in terms of like its tissue structure. But what happens if you start eating away at this tissue structure long enough? It can be replaced by a tissue structure that looks more like your intestines than it does your esophagus. And yeah, this is all sometimes leads to esophageal cancer. So this is why if someone has GERD, they might want to work with their physician to make sure that their GERD stays in check. Because it's more than just heartburn, it could lead to all these complications. And again, difference between that and heartburn, does that mean like if you get occasional heartburn, you're going to get esophageal cancer? Not necessarily, but it's about how often this is occurring, how frequent is it? And then they might monitor your pH of your esophagus, and also, so how can you prevent that? How can you treat that? Well, remember that omeprazole treats both peptic ulcers and GERD as well. So by lowering the acidity of your stomach and your gastric acid, that also helps to prevent that damage from that reflux to your esophagus as well. All right, and let's see, is that it? Yeah, I think it's repeating itself. So, okay. Yep, so that's all we have for today. Thank you for everyone who stayed the extra 25 minutes. And so if you do suffer from heartburn or GERD, this is something that might be useful to you. It's like, okay, if you're the type that likes, like I have an uncle who likes to pop aspirin like candy, and then he said, oh, I started getting ulcers. I'm like, maybe let's stop taking as much aspirin. Oh, I feel better now. But again, that's like extreme cases. He took like way too many bottles of aspirin, which has other health implications. But yeah, so that's just why knowing that bicarbonate buffer system. Again, if you're new to chemistry of all sorts, it might be really difficult. But by that system and knowing how you make these protons, how you make hydrochloric acid, this is how we're able to treat these symptoms and these conditions caused by excess acid production or a lack of gastric mucus. So that's why if you're really interested in pharmacology and medicine, it's important to know those mechanisms. And yeah, at first glance they are tough, but it's worth it because now you kind of know how they work.